Hi, everyone. It's Deidre Muirhead again, back with another Wellness Wednesday interview. And I'm really happy to introduce you guys to our guest. Again, the Family Wellness Program here at the YWCA welcomes you to the Wellness Wednesdays, where we demystify health conditions that affect minority populations. Today, we have Dr. Priscilla Barreto from the University of Miami, and we will be learning about breast cancer today.
Hello, thank you so much for inviting me, Deandra. Thank you for being here. I'm really happy to be here with you all today.
Thank you. Ms. Barreto is a hematology and oncology fellow at the Jackson Memorial Hospital and University of Miami Health System. She is interested in sarcoma, drug development, cancer disparities, and precision medicine, as well as breast cancer. We're really grateful to have her here today, and we're just going to jump right into our questions. Dr. Barreto, what are the different types of breast cancer, and which type is most common?
So, breast cancer is a big group of diseases. We usually think it's only one thing, but it's not. So, we can divide breast cancer in many different ways as well. The first way that we can divide breast cancer is by the type of cell that's going to multiply and create a breast cancer. We can call it lobular if it's starting from the cells that actually are the glands that produce breast milk, or we can call it ductal, that if it's when the first cell that is going to proliferate, it's from one of those milk ducts that we have in our breast. Other than that, we can divide breast cancer depending when we see them. If it's really localized and it has not yet invaded the surrounding tissue, so we call that in situ, or if it is invading the surrounding breast tissue, we call that invasive. Okay. We also can call inflammatory when they invade the lymph ducts of our breast. And this is the type of breast cancer that when we see, it looks like a very big inflammation, like red, and it's big. Mm-hmm. And we can call it metastatic. That's when the breast cancer has really advanced and has spread out to other places outside of the breast. The most common one that we usually diagnose is invasive breast cancer, ductal. So ductal invasive. That's the most common one.
Okay. Why is it important to get screenings early or do early detection?
Nowadays, we know that the earlier you detect breast cancer, the bigger are going to be your chances of cure and survival. And we know that if you detect breast cancer really early, you're going to have chances of survival of 97 to 100%. But if you detect breast cancer in later stages, these chances of survival are also going to start to decrease significantly. So that's why it's very important.
Okay. At what age should someone start getting screened for breast cancer?
If you look around, you might have some different information. But going by the American Cancer Association, they recommend for as early as 40-year-old, you start with yearly mammograms up to 45, but this is more a discussion between the doctor and the patient. But full recommendations, 45 years old until 55, 54-year-old, you're going to do a yearly mammogram, meaning every year. Starting on 55 and go on, you can space that a little bit more and do it every 2 weeks.
How can someone prevent or lower their chances of getting breast cancer?
There is not a specific thing that is actually going to prevent breast cancer that we can do in the general population. But there are some measures that we can have that are definitely going to lower our risk to develop breast cancer. And they're related to health lifestyle, for you to do physical activities daily, for you to have a normal weight, not being overweight, as we know that a lot of fat in your body can produce a lot of hormones. But also for people, there is one thing that I need to mention, that if you have a family that has a lot of breast cancer, meaning a lot of breast, or also ovarian cancer, pancreatic cancer, you need to look out for your doctor and mention that to your doctor, because you might be a candidate to have genetic testing. And if you are found to have a mutation, a genetic mutation that passes on your family, you might be a candidate to have more severe measures to prevent breast cancer, meaning to have bilateral removal of the breast.
What should someone expect during their first mammogram?
So mammograms can be a little uncomfortable, right? You go to this room, they're going to remove your shirt, and you're going to have your breasts examined. It's usually the mammogram is an X-ray. So you're gonna have two plaques. They're gonna come and they're gonna press your body on each side. And this pressure can cause a little bit of pain. That's why I usually recommend my patients to don't go to the mammogram while they're on their menstrual periods. That's when we have our breasts a little bit more painful and more sensitive. So I usually recommend for you to go outside of that period. Expect for it to be a little bit painful, but it's going to be a pressure and it's not going to last much. It's going to be for only 15 seconds. And then they release it and they're going to create two images that are going to be evaluated by your doctor. So it's a very short moment. And if you have a lot of pain, you can also discuss with your doctor to see if he can give you some pain medication that can help with the exam.
If somebody receives a cancer diagnosis, how long after a diagnosis should someone expect to receive treatment?
This answer can be varied because breast cancer, like I said, it's not only one thing, right? And usually this needs a discussion between the patient and the doctors and all the multidisciplinary team that is involved. But the big thing here is as soon as possible. As soon as we have a diagnosis of breast cancer, you should be looking for a doctor and should be discussing that to receive the appropriate treatment as soon as possible.
Okay. What are the different treatment options out there nowadays?
So breast cancer, like I said, it's a multidisciplinary treatment. So usually when somebody is diagnosed with breast cancer, he arrives to a clinic and he's going to be evaluated by the medical oncologist, like myself, but he's also going to be evaluated by the surgeon, the radiation oncologist. So all of these can be involved in the treatment of breast cancer. And you can divide the treatment in two types of treatment. You can divide in local treatment, meaning surgery or radiation that's going to do a treatment localized, or you can do systemic treatment. Systemic treatments that when we involve chemotherapy, immunotherapy nowadays, hormonal therapy, or targeted therapy. All of these, which type of treatment he's going to receive is going to depend on the type of cancer that the person has and what's going to be decided between what is the best for the patient and he's comfortable in the treatment that he's going to get.
Okay, thank you. I do have a question that has come up quite often recently for me, so I'd like to ask it. And that is, I know that one of the risk factors for breast cancer is radiation, right? Exposure to radiation. So I've had a few clients come up to me and ask, well, if exposure to radiation is what causes breast cancer, why is that considered a treatment? So could you explain that?
Yeah, it can be a little tricky for us to answer that, but this type of exposure, it's not 100% that somebody's going to receive radiation that's going to develop breast cancer, right? And it's not, and we know nowadays with our research that the radiation is going to affect the cellular proliferation, and it's going to affect all those cells that are malignant cells. And then it's part of the treatment, and it has proven with a lot of studies that they enrolled a lot of patients with a lot of breast cancer that it helped to control the cancer in certain sites and prevent for the cancer to come back.
Okay, thank you. I really appreciate that. That is something that, well, as we were talking about treatment options, popped into my head. I wanted to ask, what is the survival rate when it comes to breast cancer?
So in the United States, the survival rate we call it a 5-year survival rate and a 10-year survival rate. Okay. So 5-year survival rate of breast cancer diagnosis in the US is about 90%. So in a 10-year survival rate, it falls a little bit to 86%, but it's still very high.
Yeah, those are really high numbers. I'm really happy to hear that.
Yes, but we can get those numbers if we diagnose them early too, right?
I wanted to ask, what health disparities contribute to the occurrence of breast cancer?
So breast cancer, like in many other health situations, there are disparities, right? White women are actually more likely to develop breast cancer, but if you look at the younger population, women younger than 45, Black women are more likely to be diagnosed in that age range. And they usually develop very bad breast cancers, more aggressive types of breast cancers, and they also have a higher mortality rate, even though the white women are diagnosed more of breast cancer. And the reason of that can be the biology of the tumor. Maybe those tumors are more aggressive per se, but also the access to healthcare. So we believe that socioeconomic factors and the access to healthcare are also impacting of this higher mortality.
Okay, thank you. And then our last question for you is, how can we promote screenings for people and create a positive conversation around screenings and intervention?
The first thing that I think is knowledge. So we need to understand and demystify this thing about breast cancer. Breast cancer is diagnosed early, it's curable, and we just need to reach for that. We should not be afraid of it. We should be doing screening, doing our part, diagnose it early, and have it cured. So knowledge that we have those options is the most important thing. Also, I believe our health system here can be sometimes very tricky, how to navigate, how to go to the right places to do your mammogram, how to go to where to go, which doctor to go. So that can be a little difficult. So talk more with each other, know what's going on with the others, exchange experience, see where, when should we be doing all those things. So knowledge is the most important thing in communication. So exactly what you're doing here.
Thank you. So that is the last question that I have for you. And I really appreciate you taking the time to come and speak with us today and educate the community, as well as myself and other organizations about breast cancer. Remember, everyone, that earlier detection helps you and everyone else around you. Thank you, Dr. Barreto. I hope that you have guys enjoyed this Wellness Wednesday and have a wonderful day.
Thank you for inviting me.